Gonorrhea, also known as a gonococcal infection, is an STI that affects roughly 160 million people worldwide each year. But firstly, what is an STI? Well, an STI is a sexually transmitted infection, though you might hear some people call it a sexually transmitted disease, or an STD. The term infection is preferred, as someone infected with gonorrhea can still infect other people and show no disease symptoms at all. Gonorrhea can cause all kinds of problems in anyone that is infected. For women in particular, infertility and ectopic pregnancies can result from a gonorrheal infection. This is where the baby begins to grow outside the womb in the fallopian tubes, which link the ovaries to the womb. This can be very dangerous for the mother, and the baby will be lost as a result. Since the arrival of antibiotics, gonorrhea was relatively easy to treat in the past. If infected, you could go to your local clinic and pick up a course of antibiotics to treat the infection. But now, gonorrhea has become resistant to many antibiotics, meaning that these drugs no longer work in killing this bacterium. The fact that gonorrhea has become resistant to antibiotics has become a global health problem, as it is so easily spread. The first case of resistant gonorrhea was seen in Southeast Asia and was next seen in the United States. In 2016, the first case was seen in the UK, and it doesn't show any signs of stopping. Gonorrhea has now even been classified as a superbug because it has become resistant to so many types of antibiotics. This means it has now become really difficult to treat. Scientists are currently attempting to discover alternative methods to treat this antibiotic-resistant disease. Currently, at the University of Southampton's Faculty of Medicine, Dr. Myron Christodoulides and his team are investigating potential routes for new treatments to combat gonorrhea infections.
We have two main approaches to combating antimicrobial resistance due to gonococci. The first approach is to try and develop new antimicrobials. So that would be developing new antibiotics. And the second course would be to try and develop a vaccine. And now the work that we've been doing in my laboratory is focused exclusively on vaccine development. And this actually is a process that we have been doing for the last 30 to 40 years. Indeed, it is so difficult to make a gonococcal vaccine that it's now become a major goal both for academic laboratories doing infectious diseases research and also the major vaccine and pharmaceutical companies. Gonococcal infection is a sexually transmitted disease, so you would expect those people and age groups at most risk to be from teenagers onwards. If we eventually do make a successful vaccine, we would predict that the most at-risk groups that we would want to vaccinate is teenagers and onwards, so teenagers and sexually active adults.
The fact of the matter is that any one of us can be infected at any time, and we may not even know it. So remember to be safe and use a condom, as that's one of the best and most effective precautions you can take.